Hello, everyone, and welcome to this week's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armin Budish, Board of Health Commissioner Terry Allen, Cleveland Clinic Chief of Medical Operations, Dr. Robert Wiley, Board of Health Director of Epidemiology, Jana Rush, and Board of Health Medical Director, Dr. Heidi Gullett. As usual, we will begin from hearing from our speakers, and then we will go into questions from the media. As a reminder, we please ask the media to stay muted until they are asking their questions. And with that, we will begin with Executive Budish. Thank you very much.
Thank you. Good afternoon, everybody. It's great to be talking with you at our regular media briefing. We appreciate the work that the media continues to do to help us get the word out about important programs and updates. I thank the Board of Health, particularly Director Terry Allen, Dr. Heidi Gullett, Ramona Brazil, and Jana Rush for their hard work and their dedication to the health and safety of all our county residents. I'm especially excited that we'll be joined today by Dr. Robert Wiley, who's Chief of Medical Operations for the Cleveland Clinic. He's also the Pandemic Zone 1 leader for our area of the state, and he's charged with managing the coordination of our hospital systems in their response to COVID. Today, I want to start with an update on the election. I have regular discussions pretty much every day now with Anthony Perlotti, who's the director of the Board of Elections. He tells me that we continue to see record turnout. So far, almost 45,000 people have voted in person at the Board of Elections downtown. In 2016, the entire early vote count was just over 38,000. Vote by mail is also very strong. The BOE has 341,000 applications and 281,000 voted ballots returned as of yesterday. That's an 83% return rate, which means there are still almost 60,000 vote by mail ballots that have not yet been returned or received. But we've already smashed the numbers of voted mail ballots from 2016, when 193,000 ballots were received. 193,016 compared to 281,000 so far this year. That's a wow. If you still have an absentee ballot sitting on your kitchen table maybe, what should you do now? You can still put it in the mailbox. As long as it's postmarked by Monday, November 2nd, it should be counted, even if it doesn't get to the Board of Elections by Tuesday, Election Day. But here's a couple of warnings. First, check the pickup time on the mailbox. If you put your ballot in the mailbox on Monday after the pickup time, it won't make the cut. It won't get the right postmark, and your vote won't count. The second concern is this. If it's postmarked by Monday but doesn't get to the Board of Elections by Tuesday, will it be counted? It should, because that's Ohio law. You may have seen in the news that in a couple of states, the courts have said that those votes coming in after Tuesday will not count. Ohio is different because those states did not have a state law passed by the state legislature extending the time to count ballots. Ohio does. So votes coming in after Election Day should be counted. But if you're worried, you can drive up to the drop box at the Board of Elections at 30th Street downtown and drop it off without even getting out of your car. That's what I did. And it took only about 3 minutes. You can do that up until polls close at 7:30 p.m. on Tuesday. And of course, you can vote in person, early at the board, up until Monday at 2 p.m., or vote on election day at your polling place, the old-fashioned way. I know that people are concerned about their safety and the safety of the polling locations. Our sheriff's department is charged with protecting both the polling places on election day as well as the Board of Elections for early voting, and they're protecting the security of your ballots at all times. I've been engaged with our sheriff and his team regarding their plans for the election and post-election as well. And I'm pleased to say they have a robust plan in place. What they plan to do, what the plan includes, is providing protection for ballot security, providing safe access to polling locations, assisting in maintaining order and peace at the polling locations, and preventing any harassment or intimidation. I can't provide specific details due to the fact that these are security operations, but I can say this. The plans include both static positioning at specific locations and mobile response as needed. The team is on call, vigilant and prepared. Their goal is to make people feel safe and secure and to make sure that our voting process is safe and uneventful. The most eventful thing that should happen to you on election day is that you get your I voted sticker. If you see or hear any harassment or intimidation, call immediately. If you believe what you are seeing is an emergency, you should call 911. If it's not, you can call our sheriff's line at the number on the screen, 216-443-6085. I also want to assure everyone that the polling locations will be following the best COVID protocols, including sanitizing, social distancing, and masks. When you go to vote, please bring and wear your mask. One more thing related to voting. Every election season, there are concerted efforts by groups to suppress votes, to confuse people about the voting process. It's the same this year, and we need to be vigilant about misinformation. For example, people in Shaker Heights reported receiving robocalls saying that their polling locations will be closed on election day and that they would need to go downtown to vote. That is not true. All polling locations are safe and open. Federal authorities, including the FBI and Homeland Security, are aware of this activity and other instances around the country of the same type of misleading and false messaging. If you have any questions about voting or your polling location, you can call the Board of Elections at 216-443-VOTE. 443-VOTE. Now, switching gears. At our last briefing, I told you about a series of community conversations that we were holding to discuss the impact of racism on people. I'm pleased to say that we held 3 of these conversations with over 200 participants and many facilitators and scribes capturing the conversations. I want to thank the Cleveland Foundation for their support of these conversations and their help with the use of their Common Ground platform. I've heard back from many who took part in the conversations that they were meaningful and impactful. We are now gathering all of the information and will be pulling together a report. We hope to be able to present the resulting report back out to the community in the coming months. Meanwhile, I know that CASE, the Equity Advisory Council that we created, is working on more ways to get input from residents, so we can continue to listen to your concerns and your experiences and work to use those to design solutions. Unfortunately, racism is deeply rooted in American society. It's only through real connection and a desire to make change across the board that we'll be able to see a brighter future for all of us. Finally, I'll end with a quick word about COVID. I'm pleased that we didn't go to purple this week, but I have to say that I'm very, very concerned. The governor had a call with me and other county leaders this week, and his message was clear. We have to stay vigilant. People are tired, and they just want to return to normal. I know I feel that way. There's nothing wrong with that. And as the days get shorter and colder and darker, it's going to be hard to face a winter of isolation and worry. But we have to do everything we can to protect ourselves and our families. The protocols that are in place are good. They work. People just have to follow them. You've heard it before. Wear a mask, social distance. Wear a mask, wash your hands. Wear a mask, sanitize. And by the way, wear a mask. One last item. Yesterday, the governor asked all counties across the state to form COVID defense teams. These teams are designed to coordinate the fight against the virus. I spoke with Mayor Jackson, and we agreed that we'll have our emergency operations centers and our boards of health work together to lead the defense effort. This will further our ongoing collaborative conversations that we're already doing all the time. So, thank you, and now I'll pass it over to Terry Allen.
As always, thank you, Armin, for your partnership, for your leadership through this pandemic, and which has been a very difficult time, certainly for all of us. We're very grateful for your enduring support. As mentioned, we're fortunate to be joined by Dr. Bob Wiley, the Chief Medical Officer at the Cleveland Clinic, and also the Zone 1 leader for the hospitals in this northern Ohio area in the pandemic response. We appreciate his coordination across systems. We also have our Director of Epidemiology, Surveillance, and Informatics, Jana Rush, and Dr. Heidi Gullett, our Medical Director. So yesterday we heard that Governor DeWine announced that the Cuyahoga County will remain at risk level 3, public health emergency, or RED, in the public health advisory system. We currently meet 5 of the 7 indicators for the advisory system, including new cases per capita and a sustained increase in these new cases, a proportion of cases from non-congregate settings out in the general community, and hospital admissions increasing over the last week. Last week, Cuyahoga County was on the watch list, as Executive Budish noted, for at risk level 4 or purple designation. This, of course, is very concerning, particularly with the overall regional and state trending showing high rates of transmission in 86 of 88 counties in Ohio. In his press briefing, the governor said that yesterday, Ohio reported 3,500 new cases of COVID-19, 700 more than their highest numbers to date. He said that, quote, "The virus is raging and there's no place to hide. It will take all of us to turn the tide." Back in August and September, our high degree of local mask use in public spaces, following physical distancing guidance, avoiding gatherings, implementing remote work options, and promoting hand hygiene and staying home when we're sick, worked to keep our cases down. We can't let our guard down during cold and flu season. We know that COVID fatigue has set in, and the results may be devastating if we're not vigilant. The spike in cases that we're seeing now extends well beyond Cuyahoga County, with a total of 43 red counties now at level 3 in the public health advisory system, representing 78% of the population of Ohio. Infectious diseases don't care about boundaries on a map. We're finding that people are wearing their masks in grocery stores, in workplaces, in department stores, and then taking them off in private residences and social gatherings. There really is no difference. We have to recognize that the risk is the same in all those settings. We're seeing people expanding their social circles and gathering in groups indoors, and sometimes gathering outdoors very closely during some seasonal events. Maintaining small bubbles of social interaction is good prevention, particularly in times like this, and we know it works. This increase in social mixing without masks in the fall, as people begin to move inside, can have a dramatic impact on our trajectory going forward. Statewide, 6% of people have been tested positive for COVID-19, which doubled since early September. And we're very concerned about the rising positivity rates right here in Cuyahoga County, and you'll hear about that soon from Director Rush. This week, we've been averaging 130 cases a day in our jurisdiction here in Cuyahoga County. And today, just yesterday, we saw 170 cases, 170 in one day, and again today. If we add in cases occurring in the city of Cleveland proper, we are well over 200 cases a day over the last 2 days. We've never hit these numbers. This is an all-time high for us here at the Board of Health. We also continue to see stark inequities within African Americans compared to whites. African Americans are now 2 times more likely to be diagnosed with COVID and over 3.5 times more likely to be hospitalized and more likely to die than their white counterparts. It will take all of us working together to prevent hospital surges and fatalities in our community. We have to respect this virus. Boaters on fishing expeditions that have been caught on Lake Erie during a storm understand that they must respect the lake or they may pay a terrible price. In the same way, this virus will make us pay a dear price if we don't respect it by following the prevention playbook and doing our part to keep our community safe. Let's remember the basics. People should self-monitor for symptoms of COVID-19 and get tested if you develop symptoms. If you've been in contact with someone that has tested positive recently for COVID-19 or someone with COVID-19 symptoms, stay home 14 days after your last contact with that person and monitor yourself for symptoms. If you are tested for COVID-19 during the quarantine period, that is that 14-day period, and test negative, you still need to remain home for that full 14-day period in case symptoms can develop. Remember that it's between 2 days and 14 days from when you may be exposed to symptoms could emerge. If you're tested at any one point in time, you still could become positive later. So that's why we have the full 14-day quarantine period. If you are diagnosed with COVID-19, we want you to remain in isolation for 10 days after symptoms start and resolution of a fever for at least 24 hours without using fever-reducing medications and with improvement in other symptoms. We also know that there's an increased risk of severe illness from COVID-19 among older adults who have chronic illnesses such as asthma or diabetes, have obesity or have overweight, who smoke or have a history of smoking. And we should avoid direct contact with these folks who are considered high risk to protect them. My parents are 80 years old and our contact with them is at great distance and with a mask. High-risk individuals should take extra care to follow these precautions. Stores should consider offering hours available for seniors only shopping to reduce exposure risk for at-risk customers. And of course, we want you to get that annual flu shot, and you can go to fluvaccinefinder.org to find that flu shot. And you want to limit these in-person interactions with others who are outside of your household and avoid gatherings of any number. This is where we are seeing transmission happen right now, in social gatherings, in people's houses, without masks. The risks are there. It would be best to postpone large gatherings like weddings, receptions, or parties with extended groups of family and friends. This will help prevent transmission of the virus during the holidays. For schools that are providing hybrid or full in-person education or holding extracurricular activities or sporting events, paying special attention to safety precautions is essential. Students should not gather in groups outside the school setting and school activities. Consider working remotely if you can, where options are available with your employer. Follow good hand hygiene standards. Washing your hands frequently with soap and water for at least 20 seconds. That's singing Happy Birthday song twice. Use hand sanitizer frequently and avoid touching your face. Cover your coughs and sneezes and blow your nose into a tissue or sneeze into your elbow. Our continued vigilance is our way out of this pandemic as we wait to learn more about the timing and availability of a COVID vaccine in the offing. Before I begin to wrap up my comments, I want to say a few words about our work with our local schools. As I've mentioned multiple times, we've been meeting with the schools almost weekly since graduation in the spring. Based on input we received from the local school superintendents, we know that some districts have chosen to educate students in a hybrid or fully in-person setting. They are working hard to adhere to following protocols regarding personal protection, sanitation, and environmental controls. We appreciate their dedication to providing students with the quality educational opportunities they deserve, regardless of the setting of how kids are being educated. As a group, local superintendents are in constant contact with our agency, often daily. We provide them guidance and assist them in making sound decisions from a public health perspective. They help us with contact tracing. We give them some guidance on environmental hygiene and other related important factors as we work together through this pandemic. We fully appreciate the pressure faced by school officials. We also fully support the need for them to make decisions that they feel are right for their in the best interest and are in the best interest of their respective school communities. I want to take a moment to thank all the staff that have been working round the clock at our congregate care facilities in the community to keep people safe during this pandemic. They're caring for the developmentally disabled, the homeless, those in long-term care facilities, adult care homes, and many other settings. And they're doing their very best to protect the people in their care, and we appreciate their partnership. Finally, I often remind myself about the stark reality of this pandemic. This virus does not have a conscience. It doesn't get tired of infecting us. Left to its own devices, it won't stop until most of us are infected or vaccinated, period. But we have the power to snuff it out by following the prevention steps that worked so well for us in August and September. Masks on, keep your distance, and avoid gatherings, and stay home when you're sick. This is how we fight back together. And now is a more critical time than we've had during the entire pandemic. What happens right now and the decisions we make here and now in the coming weeks will have a big impact on just how devastating this virus will be on our community. And none of us can bear to see more deaths than we've already seen in this community. So I thank you for your time and attention, and I'll turn it over to Dr. Wiley.
Thank you, Terry and Armin, for the opportunity to talk today. Yesterday, the U.S. reported nearly 9 million cases of COVID since March, as well as 228,000 fatalities. In a single day, we had 90,000 cases and over 1,000 fatalities reported. And Ohio also has 209,000 cases and about 5,300 fatalities. And over the last 24 hours, as Terry said, over 3,500 new cases were reported with 19 fatalities. For a 7-day average, that's up nearly 60% to over 2,600 cases, and fatalities have driven up about 70% to 16 a day. So still relatively low, but moving in the wrong direction. Over 1,500 people are hospitalized, and that's a 50% increase over the last 14 days. In Zone 1, which is the northern part of the state, we have 690 people hospitalized. And let me tell you about Cuyahoga County. Cuyahoga County has about 5,000 hospital beds, about 1,000 intensive care beds, and about 700 ventilators. And fortunately, what we're seeing now is not affecting us in terms of hospitalizations quite yet, like it is the rest of the state. We only have 169 COVID cases hospitalized within the county, and that's with a bed capacity of 5,000 and an ICU capacity of 1,000. Right now, our hospitals are about 75% full, so we certainly have capacity. But keep in mind, this goes in 3 phases. The first phase is infection. 2 or 3 weeks later, it's hospitalization. And then the third phase is fatalities, which is 2 or 3 weeks after that. So if we can show the first slide. I just want to remind everybody who gets infected in terms of the infection rate. And you can see this is a graph of the age of infection. And you can see how younger people in the green get affected more often, but older people who get infected less often are the majority of the fatalities. In fact, 79 to 80% of all the fatalities occur in people greater than 65 years of age. Next slide. This data is from Ohio only, and this is from the beginning. So the first patient in Ohio came into the hospital or was diagnosed on March 9th. And you can see the subsequent hospitalizations which occurred kind of in the first peak, which occurred in late April. Well, what happened? After the first case, several things happened pretty quickly. So the governor declared a state of emergency. Schools were closed. Schools were closed and followed 48 to 72 hours later, bars and restaurants. And then by the 14th of March, there was a stay-at-home order. All of that activity had a dramatic effect on blunting the curve and reducing the number of people who got COVID, and therefore the number of people who needed to be hospitalized. By the end of May, the first part of June, things are going very, very well during that dip. And so the governor relaxed the orders. We began to open up in terms of the businesses, and we also started to decrease the use of masking. But within 6 to 8 weeks, that led to our second peak in the end of July. Just before that, the governor reinstituted the mask order, and you can see once again the number of cases started to go down. Well, nothing significant has changed since then, so why do we have this third peak? Well, we have this third peak for a couple of reasons. One is because kids are back in school. We have 1.5 million children K through 12 in Ohio, and about 500,000 college and university students. A lot of them are in person, and so there's a chance for transmission within the school systems or college and university systems. The second thing is we had Labor Day, and we know following family gatherings on Labor Day, just like we did on Memorial Day, we see an increase in the number of cases, and 2 or 3 weeks later, an increase in the number of hospitalizations. And finally, it's getting cooler. And with cooler activity, people are outside, they're moving inside. We know that the virus can be aerosolized and stay in the air for an extended period of time, and therefore it's more likely to be transmitted. So what are we asking you to do now? Really, first thing is we want you to recognize that the next 6 to 12 weeks are going to be difficult. They're going to be challenging. There are going to be more cases. What we want you to do is not give up right now. And as Terry has said, what we want you to do right now is to double down. We want you to use a face mask consistently. We want you to social distance. We want you to be careful about the number of people that you socialize with in an enclosed room, particularly indoors during these winter months. And finally, we want to give you some hope. We won't be talking this way in the next 6 to 8 months. In 6 to 8 months, we will have a vaccine. We'll probably have a vaccine distributed either later in November or December, probably have someplace between 10 and 30 million doses by the first part of the year and 200 or 300 million at the end of the first quarter. But it will take a while to distribute those vaccines to everybody in Ohio as well as around the nation. So we won't expect a lot of people to be immunized until the end of the second quarter or perhaps the middle to the end of the third quarter. So this is your COVID year. It's time limited. What we need you to do right now is we need your help. The first peak in Ohio was all about personal protective equipment because it was made in China and Italy. We didn't have a lot of it. We were afraid of running out. The second peak, we're worried about rooms. So we all expanded the number of rooms and increased our ability to take care of patients in terms of hospital rooms. The third peak isn't about either one of those in terms of our worry in the hospitals. What we're worried about is personnel. One reason we're asking you to wear masks is because we need to keep the hospital personnel healthy so they can take care of an increasing number of inpatients. And with that, I'll turn it back to Terry and Armand.
Good afternoon. Thank you, Dr. Wiley, for that presentation. So I'll be covering the data information for the Cuyahoga County jurisdiction. Okay, so if we look at the first half, we have a total number of cases, 14,521 cases have been reported to date in Cuyahoga County. As Commissioner Allen stated earlier, we have averaged 130 cases reported per day this past week, and we've had our highest number of reported cases in a single day since the pandemic has begun of 170 cases reported. To contrast this compared to an average of 50 cases that were reported for all of September. We had 8 new deaths reported this week. This was similar to last week's report, but sadly we have surpassed 600 deaths reported in the district. The overall percentage of deaths have remained stable over the past month at approximately 4%. For our hospitalizations, we've seen a slight decrease over the past month from nearly 10% of our cases representing hospitalizations to about 9%. For our case demographics, we have remained stable over the past month for all of our demographics. Over half of our cases are females. The largest number of our cases are represented for the 20 to 29 age group. About a quarter of our cases are among healthcare workers, and slightly over a third of our cases have a pre-existing condition. Next slides. So as you can see for our epi curve, we absolutely had a peak in our cases during July, and now as of October, we are currently increasing to that number that we were seeing in July. So we are currently in the next peak of our cases being reported. As we stated before, the last couple of weeks that are noted on our epi curve, those weeks are preliminary because those cases may not have been reported yet to us. Next slide, information. So for the geographic distribution for our cases has also remained stable over the past month. The highest number of cases have been reported in zip code 44107, and the lowest number of cases have been reported for zip code 44040. Next set of slides. So for our hospital utilization, our hospital bed capacity for adult medical and our critical care bed usage has remained stable as well over the past month. Next information. So for our testing rates, Cuyahoga County hospital testing positivity rate is steadily increasing for the 5th week straight. There has been an increase from 5.1% to 6.7% reporting this week. That's representing the highest aggregate positivity rate since July. Testing positivity rate in Cuyahoga County for nursing homes has also been increasing, and we're now at 4.5%. So I'd like to close in also putting our data into perspective. Our cases have been increasing more rapidly within the county over the past 2 weeks, which puts us at risk for increased hospitalizations and deaths within our community. Cases are increasing in part due to our increased mobility within the county. And so we urge everyone to take precautions and not gather in groups and only include those that are within your household as we approach the holidays, so that we can ensure to continue to do our part to slow the spread of this virus within our community. Thank you. And so now we'll turn this over to our medical director, Dr. Gullett.
Thanks, Jana. I just wanted to talk to you a little bit about testing. You know, we've talked before about how many locations there are in the community, and that continues to increase. But I want to again remind all of our listeners and viewers that testing is really important. Testing is the only way that we know if you have the infection, and it's the only way we know if we can isolate you and contact trace and quarantine those you've been around. That's how we stay ahead of this infection. So it's critically important to be tested. The locations now are widespread across the whole Northeast Ohio region, but specifically here in Cuyahoga County. There are a number of places you can be tested that I'm going to walk through for the next few minutes. These are places you can be tested with or without insurance and at no cost to you. We have multiple community health centers that are testing individuals from 0 age, so newborns, all the way up to adults, older adults. And you can find those locations at clevelandcovidservices.com. Again, no age restriction, and they take individuals without insurance without any cost sharing or any cost to you. There's also a list of testing sites at ccbh.net. These are community testing sites for Metro Health and Cuyahoga County Board of Health collaboration. And those sites are listed over the next few weeks, and additional sites for November and December are coming soon. So please continue to check back to our website for the most updated information. We test individuals at those sites who are 10 and older. There are also a number of pharmacies who are testing. CVS tests those who are 12 and over, Rite Aid tests those 18 and over, and Walgreens tests those 3 and over. So please check their websites for more information on how to register and obtain an appointment. Ohio National Guard has also given a ton of support to our Northeast Ohio community, and we're incredibly grateful for that. They're doing a number of pop-up sites, and for most of those pop-up sites, they take individuals 2 and over. You can find those pop-up sites staffed by the National Guard at coronavirus.ohio.gov. I also want to remind you that you can contact your own personal healthcare provider and our hospital systems, who may be able to also help you with a test if they feel that is necessary. I also want to reiterate something that Terry said earlier. We strongly encourage you to get an influenza or flu vaccine this year. There are many types of vaccines available, and they're currently widely available across our county and our region. Many of the sites that test that I listed above are also places where you can obtain a flu vaccine. So please check out their websites and register if you're interested. We strongly recommend it this year, even if you've never had it before. This is the year to get your flu vaccine. Next, I'd like to just say a few words about contact tracing. Contact tracing is critically important. Anytime you've been around somebody who has been diagnosed with coronavirus or COVID-19, we really need you to cooperate with us when we call or another local health department calls. We are not divulging information or protected health information about the person who's infected. But if we're calling you, that means you're on a list of somebody who's been diagnosed positive and you've been in contact with them. We're calling you to give you information, to see how we can support you while you remain in quarantine, and to help you know what to look for because you're at risk of this infection. It's also important to know that if you've been in contact with someone who's tested positive, it's important to get tested. So please check out those locations I said above. Most of them are drive-through locations so that you don't risk exposing anybody else since you're a contact. And finally, even if you get tested and you've been a contact, but your test comes back negative, we really need you to stay in quarantine the full 14 days. We know this infection can appear anywhere from 2 to 14 days or 2 weeks after the last time you encountered the person who was positive and they were shedding the virus. So a negative test before that 14 days does not get you out of quarantine early. We're still worried that you may develop the infection and spread it to others. So that's really important. Next, a few words on gatherings. You've heard my colleagues talk about this. All 3 of my colleagues today. It's really important that everybody knows that we're seeing a considerable amount of spread through small gatherings. I personally did contact tracing in the past week and traced multiple cases back to small gatherings. People sharing some food, people getting together. Yes, they may be your family. Yes, they may be your friends. But if you don't immediately live with them and they're going other places, there's a potential that you could give it to them and they could give it to you. So please listen to our concerns today. We see a level we have never seen before in this pandemic, and limiting those personal gatherings, those small gatherings, particularly when your masks are off and you're eating and you're inside, those are really important. Next, we want to remind you to please stay home if you're ill. We recognize other viruses are out and about these days, but we can't separate them from COVID right now. So if you feel sick, even if it's just feeling like you got a cold coming on, please stay home. Please contact your healthcare provider. Or if you don't have one, please call one of our hospital COVID lines and they can help you with further directions. And if you're waiting for the results of a COVID test, we also ask you kindly to please stay home. Those things are critically important to us getting ahead of the pretty significant surge that we see right now. As you heard Dr. Wiley talk about, we're very concerned not just what happens in the next few days, but what happens in the coming weeks as our hospitals continue to fill and we continue to see more loss of life. We don't want any more families in this community, across the state of Ohio, or across our country to lose any more loved ones. So it's really incumbent upon all of us. It's critical that all of us do the things we can do. Masking, staying home when sick, not having gatherings, and other similar measures. Finally, in the moment of gratitude, I would like to say some words of thank you to our hospital partners. We had some needs for some lab testing in the past few weeks, and all three of the hospital labs that are a significant amount of the COVID testing in this community, Cleveland Clinic, Metro Health, and University Hospitals, stepped up to test in large volume when we needed them to do that for a public health need. So while they continue to do that for lots of hospital patients and people in emergency departments and in community health centers, they also helped us when we needed it for public health reasons, in addition to all the other care that's being provided. And I can't say enough about the incredible partnership that we saw with our lab partners this past few weeks. So it's been there all along, and I know the state governor has asked us to work together across lots of sectors to really fight COVID. That's what we've been doing all along here, and this is just another example of that from our hospital lab partners. So from the bottom of my heart, I thank you all for that. I know I've told you individually, but I really wanted this to be publicly acknowledged as well. Finally, this is a pretty divisive time for all of us. It's a stressful time, regardless of, normally elections can be, but now we're in the midst of a pandemic like most of us have never experienced before. So I just want to go back to some things I said back in March and April and maybe a few other times. And that is just to really try and be kind to one another. I think all of us are stretched to the limit. I speak for myself. There's a lot going on. As a parent, as a professional, as a resident of Northeast Ohio, there's a lot going on. But if we can be kind to one another, I think it will help all of us to have a little bit more of a smile in our day. Regardless of whether you disagree with someone politically or about their decisions regarding what their children do or how they go about their lives during COVID, please disagree respectfully and please be kind. We're only going to make it through this pandemic if we're kind to one another and we do it together. So with that, I'll pass it back to Devin for questions and answers from the press.
Dr. Gullit, thank you very much for your comments and everyone else for their comments. We now have a few minutes to get some questions from the media. Just a reminder to please identify yourself and your outlet when asking your question. Thank you very much.
Hi, this is Anna Huntsman from IdeaStream.
Hi, Anna, go ahead with your question.
Great, thank you. So obviously, the increases in cases and red alert, the being almost on the purple watch list, it's on a lot of people's minds, and we've had a lot of people asking, what can we expect if we would ever branch into that purple, category, or just if we continue to see all of this happening at an alarming rate? Are there any steps or orders that the county would take, any closures, shutdowns? I guess I'm just asking what the plan is, because people are wondering if there's any, what could we expect if we were to go into that?
Well, I can certainly start off with that, Anna. I think from our perspective, the state public health advisory system is based on a range of triggers. As you know, there are 7 indicators that tie back to, the cases overall, the rate of new cases, understanding what's happening in emergency departments, in intensive care units, overall hospitalizations, with emergency rooms in general, and those numbers change over time. So you may see situations, and we have seen situations where people may go from orange to red. We've had red to watch list as we were on with Clark County and Hamilton, and now back at red. So some of that fluctuations is sort of inevitable. I think people should be less concentrated on the purple to red indicator and understand that the things we talked about today, the very issues that Dr. Wiley brought up about trending, the issues we brought up about the highest case counts to date. The highest case counts to date are what people need to understand now are critical issues. And ultimately, you know, and Dr. Wiley said this, Dr. Gullett said this, Director Rush has brought this up over many weeks, as has Ramona Brazil, our Director of Prevention and Wellness. This is really up to us. It's up to decisions that we make every day, whether or not we're going to be masking in those private houses where we have people together. You know, we know people are tired, and I think they're getting lax. And you know, what we're trying to do is to basically state today here with all of us a call to action for the community to reinvest. I remember when we were here back with Executive Budish in March, and we were talking about this in March and April. People were engaged. They saw what was happening, and they were in lockstep with the response, and that helped to drive the cases back down, as Dr. Wiley described. We saw a peak again in the summer, and then the masking helped us to drive that rate down. We're in cold and flu season, folks. We've got a long haul ahead of us the next 6 to 12 weeks. Multiple viruses that are circulating in the community, multiple viruses. And so people will start getting cooped up together in houses, having respiratory symptoms. And if we're not wearing masks, if we're not creating the distance socially, we're not working remote if we're allowed to, we're not doing good hand washing practices, then, you know, we're going to be dealing with, you know, potentially some severe illness beyond what we've seen so far. And that really concerns us. So I don't think people should concentrate so much on the color issue as now taking to heart the things that we do today will have an impact on where we are a week from now, 2 weeks from now, a month from now, and at the end of the year, where we sit and look back to see how our community has done, how many people have additionally died, how many people end up in the ICU, how many people families are more severely affected by this illness. We have to decide now to take that personal responsibility. We worry every day here about what happens. We've been worrying since the beginning. We want to do what we can because we don't want anyone to have to bear the brunt of the heartbreak that many have so far dealt with in all the deaths in this community and across the state.
Would you consider issuing? Go ahead. Sorry. Go ahead. Follow-up thing. Sorry. Would you consider issuing new guidance for schools if the county would go into that purple category, or what's the approach there?
Well, if you look at our guidance as it exists right now, and we put guidance together 6 to 8 weeks ago, that guidance is based on the public health advisory system. We had a number of preventive medicine physicians that help us work through that guidance. We had suggestions on how schools could engage, and that guidance is in place and is on our website and has been there for a couple months. That guidance suggests to schools that they should consider going remote at red and to limit activities to special needs in person. We know that schools have made choices, as I described during my comments, to go hybrid. Some have gone hybrid, some are full face-to-face, some remain remote. They're making decisions that are best for their districts and the circumstances in their districts for their students. And we know that there's a price to pay for every one of these decisions. We have been encouraged lately. We are seeing we're seeing cases in the school setting within the curriculum when they're actually in classrooms, but to a lesser degree than cases we're seeing related to sporting events, extracurriculars, or after school, or kids getting together, or groups getting together in school sort of related events after they leave the campus of the school, maybe gathering at someone's house, not wearing masks, students or other folks in groups. So we're seeing to a larger degree cases in that regard, but we do see cases to a lesser degree in the classroom setting, which is encouraging. We're going to continue to watch the data to see how that evolves. But particularly as cases, I think, begin to expand more broadly in the community, we need to recognize that if that positivity rate starts to creep up, and as Director Rush said, back in July, between mid-June and mid-July, we had a 9% positivity rate based on the data like Dr. Wiley's institution, the Cleveland Clinic provides, Metro Health and University Hospital shares with us. 22,000 people tested a week around each week. A 9% positivity rate and rising rates indicates that more people around us who may have symptoms or may not have symptoms at all, but could be infectious, could be spreading it. So we need to watch those indicators in our community, and that will help us understand not only the hospital volumes that we'll be tracking, but the risk faced, right here in front of us as we move about the community, and which certainly makes masks all the more important.
Okay, thank you.
Sure.
Thanks, Anna. I'm sorry for the interruption. Does anyone else from the media have any other questions? Going once, going twice. All right, well, with that, we will conclude this week's Board of Health and Cuyahoga County media briefing. Thank you so much again for joining us today, and we will see you in 2 weeks. Have a wonderful weekend.